TB hip joint caused by Mycobacterium tuberculosis. Skeletal TB is always secondary, and most common primary is legs, and that will be followed by viscera. Most common site of skeletal TB is spine, followed by hip and then knee. In the hip, it can originate in like 4 different sites. Roof of acetabulum, which is the most common site, then femoral head, femoral neck, and greater trochanter. Stages of TB hip, there are 5 different stages. Stage 1, synovitis. Stage 2, it's early arthritis. Stage 3 is advanced arthritis. And 4, there is like stage 3 plus subluxation or dislocation. And stage 5, there is fibrous ankylosis, or ankylosis means the fusion of joints. So there can be pathological fusion of joints. Symptoms, there can be symptoms of the TB, that is fever, loss of weight and appetite. Then local symptoms include pain, stiffness of joint, and limbing. Coming to the signs, there can be tenderness, fullness of Scarpa's triangle, restricted movements of the hip, muscle wasting, deformity. It actually depends on the stage of TB hip. Stage 1, there is Faber deformity, that is flexion, abduction, and external rotation. And Fader is flexion, adduction, and internal rotation. So there can be apparent lengthening in stage 1, apparent shortening in stage 2, and true shortening in stage 3. Variable deformity in stage 4, and in stage 5 there is ankylosis. So there is very limited painful movement. Investigation, the X-ray shows 3 findings: Phemister triad, motile and pestle appearance, and wandering acetabulum. So this Phemister triad can be a triad. So there are 3 things, and you can remember it using the code Mr. Joe. J is for joint space narrowing, O is for periarticular osteopenia, that is first X-ray change which can be seen, and E is for peripheral erosions. MRI is the best imaging modality, and blood test may also raise ESR, and aspiration of the hip, you can send the fluid for AFP staining, culture, or CBNet. Treatment depends on the stage of disease. In stage 1 and 2, it's like some articular cartilage is intact, and so you can start with, you can like treat the patient with giving rest, ATT, and traction. If it is not effective, you can go for second line treatment, that is arthrotomy, that's opening the joint, and debridement plus ATT. In 3, 4, and 5, there is actually significant like pathology or changes in the joint, so you have to go for surgery and ATT. There are 3 surgeries which are done: Girdlestone arthroplasty, arthrodesis of hip, and total hip replacement. So in Girdlestone arthroplasty, there is excision of the femoral head, and that restores the mobility, but there will be loss of stability. In arthrodesis of hip, there is surgical fusion of the hip joint. So, like instead of the pathological fusion, there will be surgical fusion of hip joint that restores the stability, but there is loss of mobility. So the joint will not be mobile. So the person cannot do like they cannot squat, or they cannot sit like cross-legged. In total hip replacement, there is restoration of both mobility and stability, but there is risk of reinfection.